So how do I respond to someone says, how we're currently doing it's fine. Our system works. It's fine. So my first answer is generically of in any process of anything that you do in practice, saying we're fine already tells me that you are not interested in moving the field forward, right? Because at one point we were just fine with an eyepiece bronchoscope, right? Because it worked. It's just fine. At one point we were satisfied with just cutting every nodule out through an open thoracotomy. Thank goodness we stopped cutting everything out. And even when we go to cut things out, we make smaller incisions now, right? So just fine. So already, like, why are you not wanting to ever try to get better? Why aren't we striving for 100% certainty that we have cancer or 100% certainty that you don't have cancer? Like, how is that not always our goal? So let's start there. Why are you satisfied with multiple CT scans if we don't need that, right? Why would you want to be radiating people if you didn't need to? Why would you not want to be able to space it out? Why would you also not want any test that might also tell you, stop, watch, and wait, get immediately over to the bronch suite or surgery or whatever, but with higher certainty, get in there. Help the patient quicker, sooner, by whatever means. So, and then I guess lastly, anyone who would say that to me, I would say, well, then let's pull your last 6 months of data and let's make sure that in the last 6 months, you've somehow never once missed a growing cancer or never once kept scanning someone whose nodule was stable and, but you were still worried about it even though Notify said it was low and it hasn't changed. Let's go back and look at, make sure you've never once needle biopsied, bronched, or surgerized a benign diagnosis. And I guarantee you, your perception is mistaken, right? I mean, it's the most dangerous words in the world. We've always done it this way, right? I forget the name of the woman whose quote that is. She was an incredible person. I wish I could remember her name, so I'm embarrassed that I can't. But it's attributed to someone who I believe was a naval officer, one of the highest ranking female naval officers back in an era when that was pretty incredible. And she was obviously quite incredible because it's one hell of a quote.